to anyone that's here today, this evening. I'll just give it a few minutes and see who else turns up. Have you had a good day anyway, Stuart, because it has been bank holiday?
I had quite a good weekend, to be honest with you. So yes,
Yeah.
it's been a very nice. I went to visit my mum in Birmingham even though I'm in sunny Manchester, very grey and depressing. Birmingham's not much better, but yeah, I spent the weekend in Birmingham,
Oh, nice.
which is nice.
Yeah, we went to Birmingham last year. It's a nice place. We went to Cadbury's.
Well, yeah, you've got to do Cadbury's, and the bin situation's tidied up quite a bit, so I
Has
was
it?
glad of that. Yeah.
I
I
read
did
about.
get
I read.
slightly a bit about it, a little bit of worry when I got in there and somebody messaged me, but no, it seems a bit more tidy than the news had it out to be.
Well, I only read that in the newspaper when we were there. It was long before that, but I'm glad they've sorted it out because not a good situation, was it?
Yeah, it wasn't pleasant to look at.
It's putting it politely. Right, so it's been a couple of minutes, so I think we'll just crack on. Before we get going, I'm just going to read the disclaimer from Nexus Fertility. So Nexus events are designed to provide objective oversight, balanced information, and general guidance. Nothing shared during these sessions is intended to replace personal medical advice. Always consult your healthcare provider with any questions or concerns about your health, fertility treatment, and changes in your condition. So we've done that bit. So welcome everyone to this week's webinar, which is I really like this title. It's Beyond the Cup: Understanding Semen Analysis, and it is we're lucky today to have one of our professional board members with us, which is Stuart Dawe Long. Stuart is a clinical scientist in andrology with over 20 years of experience and with a specialism in male fertility and sexual health. So welcome, Stuart.
Thank you. Really appreciate that.
That's amazing. If you could just give everybody maybe a little bit more background about you, what your day-to-day world looks like.
Absolutely. So, yes, over 20 years ago, I started out in laboratory medicine, trained to be a biomedical scientist originally in cytopathology and andrology, just fancy words for cells and then sperm and semen, as many people will know. Progressed through andrology because it was one of my passions, and I then developed through the professional routes to become a clinical scientist through equivalence, and also gained my diploma in psychosexual medicine alongside clinical practice and laboratory activities. And to be honest, my day-to-day life at work is a little bit varied. I manage a team, but I do also get elbow deep in the work, so to speak, and I support the team in undertaking a huge amount of andrology activities. So we're talking about diagnostics in the laboratory. We're talking about fertility preservation for men who have cancer, for example, and storing their sperm before treatment. And we also support embryology in the preparation of samples for clinical use. And that includes surgical sperm retrieval with the urology consultants. So really varied.
Yeah, it's quite a resume, that, isn't it? Like, it's a long list of things that you're experienced in. So thank you so much for being on with us today. It's really appreciated. So let's start right at the beginning. You know, what is a diagnostic semen analysis? Because if a man's listening to this or watching this, the likelihood is he's had a semen analysis. And I remember when I first kind of got told I had one or needed one, I didn't have a clue what it was. So let's start right at the beginning. What is it?
So, yeah, I don't think you're alone in that. Most people don't even know that we do that, let alone in a hospital setting. So, the first thing is, I wouldn't be surprised if most people didn't know what on earth it was. But basically, what we're doing is we're asking somebody to ejaculate into a cup or a pot, a collection container, however you want to put it, so that we can have a look at that sample in a laboratory environment. And when we're doing that, we're looking at things down the microscope, and we will move on, I'm sure, to the minor details of what we're really digging into. But we're trying to have a look at that sample from what it looks like in the pot, the colour, consistency, etc., and down the microscope to see how what is going on in that sample is probably the best way of doing it. Now, we do look at a huge number of things, as I said, but fundamentally, we're having a look at that to see what it's telling us. Now, we don't do that in isolation. It's not just have a look down the microscope and there you go, we know everything about somebody. But it's a good starting point for people who are struggling with fertility. But it's not only used for that. And I think the interesting thing is actually, I know we're talking about people's fertility journey, but we do look at it to also support people who've had a vasectomy. We check ejaculate to make sure that there isn't any sperm present. And we also can use it as a tool to monitor treatments. So if somebody is having treatments that somebody is concerned might affect their fertility, or somebody is having treatment to try to induce sperm production, we can monitor that ejaculate as we go to see how the person's responding to it. But I think overall, we are looking at it. We're trying to figure out if we can see sperm, what the quality is like, and also that tells us about the reproductive function and I guess how clear the tubes are as well in that person.
Yeah, it's plays a really important role, doesn't it? I mean, it's the first bit of information that we often get about the man because, as I did, I walked in to give my semen analysis thinking there was nothing wrong, and when I met 2 weeks later with the consultant, I was told something very differently. So, just briefly explain for us how the role it plays in kind of directing maybe the path of a fertility journey, because you know, I'm aware now that because of my semen analysis, we had to go down a different route of treatment. Like once again, someone listening to this might not understand that.
Yeah. So again, depending on what we see, can give us quite a good. If somebody's looking at, I'm going to reverse back ever so slightly. So
Yeah,
somebody's actually looking at a couple. Obviously, there's two sides to that story. Now, looking at that semen will give them a really good idea of what potentially could be going on and how they can support the treatment options. So if somebody didn't have any sperm, then obviously that sets them off to think about a different pathway for that the man and subsequently the partner as well. Of course, it's a two-person journey very often. But equally, if things are different and everything looks, and I'm going to use the phrase normal, I don't really like it when it comes to semen analysis because it's a bit more complicated than that. But if things look normal, it means that they know that his hormones are functioning as they should do, the testicles are functioning as they should do, and therefore they can probably use that sperm for different types of treatment further on down the line. Now, of course, that does depend, as I say, on the female as well in that relationship, but it's a good starting point to give them some indication of where they're going to have to go in regards to the man's journey along a particular pathway. It's again, it can be done very early on, and I think that's the other thing is we don't encourage people to go to their GPs and have a discussion about fertility. The definitions, as I'm sure everyone's aware of, is that 12 months of unprotected sexual intercourse. That is the very start of it, and that really does direct them to what they can do. And again, to go back to the results, it can also direct other tests that they should be doing. So whether or not, if somebody's got no sperm, they're going to need to check whether their hormones are functioning properly. If they're not, what hormones are going wrong and what does that tell them about what's happening to that person? And it can direct other tests, which I'm sure we'll go into a bit later as well.
Yeah, no, that's great. Thank you. Yeah, I I'll echo what you said there. I think for men it is quite difficult to go to the GPs and ask for that initial kind of test. I think especially for females, female perspective, find it easier. But men can be proactive in this themselves if they've got concerns or if they're getting towards that 12-month window, thinking, well, there might be something that I need to kind of have a check. So, what if we look at the analysis itself? What's it measuring? What we're looking for?
Okay, so I'm going to split it off into two main categories. So one of them is going to be macroscopic, and basically that's just a fancy word for before we put it under the microscope. So what are we looking at visually that we don't need that advanced piece of equipment for? Um, and the other side is microscopic, which basically means we need to magnify the images to see what's going on in order to do the test. So the first category, which is all those things that we don't need the microscope for, we're going to be looking at colour. We're going to be looking at the viscosity, which is how thick or thin the sample is. We're going to be looking at the volume, which is the amount of ejaculate that's produced on that one episode. And we're also going to be looking at the pH. So that's how acidic or how alkaline a sample is. And again, I don't know, I'm sure there's varying people here, but we're talking about, acidic being more like vinegar and alkaline being more like bleach. That's not how ejaculate is. It's a little bit less harsh than vinegar and bleach. But we're going to be looking at those parameters initially. Now, we do that in various different ways, but that can help us identify particular issues. The colour could tell us whether or not there's blood in the ejaculate, or whether or not it's looking more yellow, which could indicate that somebody might be on different medications. The volume would tell us whether or not some of the accessory glands, because ejaculate's made up of many different things, but the majority of it comes from glands that aren't from the testicle, that are through that ejaculatory duct. And actually, if that's reduced, is it telling us that there's a blockage? And we can build that information in with the pH to come up with potential situations that can indicate a blockage, for example. Now, when we put that ejaculate under the microscope, we are going to be looking for what more people are going to have heard of. So generally, most people know that we're looking for sperm numbers. That's one of the things we all concentrate on. But that's split up into different categories. But we're looking to see whether sperm are there, so the concentration and numbers of sperm. We're going to be, if the sperm there, we want to have a look at how those sperm are moving and how well they're moving, if they're moving. And that sounds a little bit strange, but sperm move, there's some they've got individual personalities, some of them. So if there is sperm there, we're looking for those ones that are moving forward really quickly. We have rapid progressive, slow progressive, and then we have sperm that are moving, but they've not got a direction. And then we've got sperm that aren't moving. And then we'll also be looking at the size and shape of sperm. So something we refer to as morphology. So we look at each sperm and then we see whether or not the head looks normal, whether it looks like the right shape and size. And then also we can look at other things. So I mentioned that if there's sperm there and they're not moving, we don't know whether they're dead or whether they're living sperm, because they might not be moving, but they still could be alive and potentially used for treatment. So we can do a test called Vitality, which basically just checks whether they're dead or alive. And we also can find things like non-sperm cells, which also indicate potential immature sperm cells that haven't quite gone through the process and don't look as you'd expect them to look. And also white blood cells, which doesn't always mean that somebody's got an infection. There could be transient infections that people aren't aware of, or there could be other things going on that give rise to these white blood cells. But all of this is used, as I say, to go back to the other question, to formulate a little bit of a picture and an idea of what's going on for that person. I think the other thing is we don't always find sperm, which we've mentioned. And again, when that happens, we have to process the sample a little bit differently. And then we will then obviously look at the health information that the patient's provided us to see whether there's anything going on that could have led to that.
Yeah, it's I find that really interesting in terms of the two different things that you're looking for in terms of what it could visually look like and before the microscope and after it. Because I guess, you know, you're a professional in the field, you can tell a lot just by looking at something before actually going right down to the microscopic. I also like the idea that each sperm has a character.
Yeah, some chase their tails, which is always one of those unique things. It takes me back to my pet animals that I've had in the past. But yeah, I think it is interesting, and you can use both. You're supposed to use both of them together. I mentioned the low pH, low volume, and no sperm is one of the typical signs that potentially is indicating a blockage for that person. So even though we look at it, and as you're right, we can tell quite a few things, you have to build all that information together.
Yeah, but it's the first stepping stone, isn't it? You know,
It
just to
is.
look at it and
Yeah.
say, right, this is. Do different clinics have different parameters for say morphology or count and things in terms of how they bracket it in terms of low, medium, high? Because I remember getting quite significant different results from different clinics, and I think maybe I know it's something that I've talked to men about in the past. They've got one set of results from one lab and from the other lab, and they can be quite different, but the numbers are similar, if that makes sense. It's just being interpreted differently by the labs. Could you kind of talk about that briefly?
Yeah, so it does depend. Now, if numbers are similar, they're interpreted, and you're getting a different answer from a clinic about what that means for you. It could be multiple different things, if I'm honest with you. So if the numbers are similar, which is different to services that give tests where you've got completely different things, it could be that they're using their clinical experience to say, this is what it's telling us. In our experience, this is what we're going to do because this is what we feel is best for you. And, you know, many expert consultants in their field will base things on some of their experience. Obviously, they've got evidence-based practice. They should be following that. But of course, there's always nuances to that. Also, some places don't have reference limits. So most reports, which we'll go on to a bit later about how you interpret them, don't always have what we call a cut-off point between normal and abnormal, because there isn't really any such thing. There's more typical and there's not so typical. And some of them will actually say that there's different groupings that you can have. So you can have borderline results, you can have pathological, you can have, you know, they can categorize it however they want. And actually, the World Health Organization does say that actually the best way to look at semen analysis is to give people some clinical decision values. So something they can say, with these results, we are going to do this for you, instead of saying that this is abnormal, that this is below, you know, fertility. There's all sorts of words that people can use that don't really reflect the true nature of semen analysis results. And again, that is separate though from other places where they process samples differently. They also could be comparing results to different guidelines. So there's World Health Organization, which is out there and is followed by many people. Accredited services, which are ones that have been given independent assessment for the quality of their results, which was recommendation from NHS England that labs have, will generally follow the most up-to-date guidelines. But some places will follow older guidelines or different guidelines from different countries. There's no real right or wrong answer that I can really say. What I would say though is that your test should be done in a UCAS accredited laboratory or something that has similar level of quality assessment to make sure that you're getting good quality results given to you.
Yeah, because it can be quite a complex and confusing moment in time, can't it? Especially for the patient, like that first kind of contact and your results given to you. So you've done your semen analysis, yeah, and you've put it through the gap in the door. You've posted it through the letterbox. What happens in terms of who's doing the test? What happens?
Yeah, so there's several things. I'm try not to talk too much on this. One of the things I'd say is I'd always want a person at the end of you handing your sample over for anyone out there. I, make sure they've got that accreditation. If you're posting a sample, I would be incredibly, I'd be questioning and making sure that actually that sample is going to be looked at in a good time frame and that it's protected from things that can affect it. But the people who are generally looking at it in most services and in the NHS at least will be biomedical scientists or clinical scientists who have had training and competence and sometimes specialist level qualifications to support them being able to do that test and to troubleshoot and make sure that they action things as they need to. They are registered healthcare professionals who are HCPC registered to make sure that we protect the public first and foremost, and ourselves as healthcare professionals. So there are a team of people who are dedicated to andrology, just as there are to embryology or biochemistry, or if you're going to get a blood test, it'll be scientists in the laboratory that are undertaking those tests.
It's it goes back. I distinctly remember having this spear that I was going to put it in the slot, and someone's hand would come out and get it, and I'd be hugely embarrassed. It doesn't work like that, but I did ask quite early on in terms of how long is it before it would get looked at, and when should I expect the results? And to be fair, sometimes it was very quick, like significantly quick. But definitely good advice to ask how long the process is, and no one's going to poke their hand out and take it directly from you.
No.
So how are semen analysis reports like interpreted? How should I've got one for the first time and I'm looking at it. What am I looking for in terms of how it's structured and kind of the overall result structure?
Yeah, right. I am going to share something. You'll have to bear with me. Can you see that?
Yes.
Excellent, excellent. Okay, so I'm just going to put it out there now. This is not what every single result should look like or will look like. But fundamentally, what you're looking at when you're looking at a result is you're going to have a set of, they're either going to call them components here. It's a very technical term. I don't like it, but there you go. There's limitations with every IT system. Or they're going to call them parameters or something similar to that. And that's on the left-hand side. Now, what that does is tell you what each of the different things that could have been looked at in that lab. Now, there's a middle column called value, and that is going through the actual results that were seen in the laboratory. Now, you can see we've got abstinence interval, whether the sample was complete, which is really important that we know and understand. Whether it's passed on premises is not for everyone. Some people do produce samples off site. We do provide a service so patients can use it here. And then we've got timings and then the actual results. As we've gone through, we've got viscosity, pH with the numbers there. Now, on the other side, most results should also tell you what would be a cutoff. Now, we've got reference range because it's just difficult in the system. It won't let you put lower reference limit, but that basically will tell you the value by which it needs to be before it becomes below, so low or higher than it should be. Semen analysis doesn't have an upper end, so it should only say low. And I'm just going to direct people, just because of time, at the very, very bottom, we've got morphology, which is that size and shape of sperm. We've got a value of 1. At the very end, it says percent normal forms, and that has got an L next to it, which we use to tell that person looking at the results that that sample is, that value is lower than the cutoff limit that we have, which is WHO. Now, we've got a little comments box at the bottom, and many, many labs will have it. Obviously, this is a report that I've blanked everything out, so obviously it won't have too much details. But that comments box will often do a little bit of interpreting for some people. For example, with this one, it may say to do a repeat in 3 months' time. It could say that the patient's been unwell, therefore you need to have a 3-month repeat. It could have information like that. So I would say go through the report, or ask the doctor, the nurse, whoever's looking after you, to go through that and ask them if there is any comments within that that they need to share with you, just so that they can have a bit more understanding, because that adds a little bit more context to the actual report.
That's excellent. Oh no, that's excellent. To see it visually really makes it easy to understand, because, as we've said several times, it is a complex thing, isn't it? When you get that set of results and you stood there thinking, or sat there thinking, what does this all mean? If one of those parameters are out, it doesn't necessarily mean that there's an issue initially, is there? That's the reason for the second analysis.
Yeah, so there's different bits of evidence you can look at out there. One sample alone doesn't give you a baseline for a person. So that's the first thing I'd say, is actually, if you want a baseline, you may need 2 or 3 different samples, and you need to see how they all compare to each other. The truth is, though, most people will only have 1 or 2 at the very most. If there's anything that's reduced or different than what the lower reference limit is, or what that clinic would define as being the lower limit for them, then the advice and guidance by NICE as well is to do repeat. There's errors with every single test. So the only way I can do it, that I think most people absolutely understood, is, and it might send shivers down people's spines, so I apologise now, COVID. We all were doing lateral flow tests, and we all said, I think at that point it was quite out there that people knew that not every test was 100% accurate. Exactly the same when it comes to semen analysis. So yes, you've got highly trained people doing it, but there's always going to be a level of error around it. And I could bore people with numbers, and when we're looking at that in the lab, what does that mean? But basically, one abnormal sample, and I'm just going with abnormal because it's how most people refer to it as, does not necessarily mean that that will be the same for the next ejaculate. That's slightly different if there's somebody who hasn't got any sperm that's seen in a sample, because the second test there is usually done a little bit quicker. So all the other ones, if there's sperm there, but there's something slightly reduced, they may do a repeat in 3 months' time. That just gives it enough time for the next set of sperm to be sort of freshly produced. That's the length of time for sperm production. But with azoospermia, where no sperm is seen, they may want one done a little bit quicker than that. And one of the reasons to do that is actually, again, there's a little bit of error. And even though there wasn't any sperm seen in the first one, the second test might show a few sperm that are there. So just because there wasn't any in the first one, we do need a second one just to see whether that is confirmed or not. But again, there's limits with every single laboratory test, so there's uncertainty around it. So it's a good idea to have more than one, particularly if there is something that's below normal.
Yeah, it's an important moment here to mention as well. If you've got not concerns, but questions about it, reach out to the lab, to the clinic, get that professional advice, because I think we fall into the trap of Mr. Google sometimes, don't we? Try and interpret things. And there's highly skilled professionals that are there, not always straight away, but you can put your question in and get an answer, get a consultation to interpret them correctly, rather than Mr. Google do the job for you.
It's really important, because the amount of people that I've had in our service, and I will talk to patients, but again, different services are different who they'll let speak to people. So you may get one of the nurses or one of the doctors. I guess it really doesn't matter as long as they know what things mean. But the amount of people who have a test, and like that one report I showed you, the morphology was the only thing that was highlighted as being below the normal range. Well, that's enough to really worry people and wonder if that is the cause of their infertility or their struggles that they're having as a couple. And then they're waiting another 3 months before they can get is this the case, or is it something else? And it's never that straightforward. So absolutely really good advice is to talk to somebody within that field, whether it's your doctor that's referred you or the clinic that's looking after you, just to get a little bit more information. And just to say, I hope most clinics as well get people to fill out health questionnaires, even if it's very basic, because as scientists, what we try to do is we look at that information. And if we was to see that somebody had an illness that caused them to have a fever, we know that affects sperm quality. And actually, if their morphology was low for that, we would then be saying, consider repeat in 3 months' time after that illness, to see whether or not that was what was causing it. So there are nuances to what should be done for each individual person. So definitely it's a really good piece of advice to get in touch with a clinic.
Yeah, it's an anxious time, isn't it? And people, when we're anxious, we want results straight away in terms of answers. But the best people are those professionals dealing with that analysis and your treatment. You've mentioned azoospermia. Can we talk a little bit about that? No sperm, no semen. What is it, and how can it occur?
Sorry, I missed the last bit there, Kieran, but I'll
I said
talk. Go on.
I said just so azoospermia. You've mentioned it briefly. What is it, and how can it occur? Because it can occur in different ways.
Okay. Yeah, got you. Sorry. Okay, so azoospermia is just the fancy word for no sperm being found in the ejaculate. Now, there's different ways that labs come to that conclusion. Most people will hear of the dreaded centrifuge in a lab, because that is how azoospermia is defined, is 2 samples that have been centrifuged, which basically just means a really, really hard, fast spin of the sample to get everything in the bottom of a tube. Other labs will use different things, but basically, regardless of which method they use, it means they've had a look using their methods and they cannot find any sperm in what they've looked at. So then they'll put out a report saying suspected azoospermia. Again, remembering there's always a bit of error. We can't 100% say for sure. So that report will go out, and basically, as was mentioned before, that will sort of trigger the person looking after that person and that couple to think about what do they need to do to understand what the cause is. So there are different causes, and the different causes can be they sort of do a differential, and that involves doing several tests. So hopefully, most people, as uncomfortable as it is for everybody, hopefully most people will have a physical examination with that doctor or that nurse or that scientist, whoever's looking after you, to just check things over, make sure that your testicles feel okay, that they can feel the tubes, that you've got hair distribution, things like that. They'll also do some blood tests, which will include follicle stimulating hormone, luteinizing hormone, testosterone, prolactin sometimes. They may also send patients for an ultrasound scan. And again, they may ask for another test. It just depends on each individual person's situation. And they use that information to basically try to direct the potential cause. And by that, we've touched upon before, there's obstructions that can happen. So that is something that basically blocks that sperm getting from the testicle out through the normal route. And it can also be non-obstructive, which is basically, it's not that, it's something else that's going on that is either stopping the sperm being produced or preventing the testicles being told to produce sperm. Now, these things, it can be really, really complicated. I'm sure on your platform, you'll have some amazing talks from people going into these different areas. But fundamentally, they've got to decide what the best type of treatment would be for that person. Now, they might also do genetics on people. That's often coming to the end of the other test when they need to get a bit more clinical information and make sure they look after that person. Because if you think about it, sperm's no longer being seen as just the fertility. There's also evidence to say that it can indicate overall health and well-being. You know, some men may have undiagnosed issues that then need to be supported through a different team to make sure they've got the full support and they live good quality lives alongside their fertility journey. But basically, that's what they're doing. They've got to differentiate between obstructions and non-obstructions. And if it's a non-obstructive, where is that coming from? Is it the hormones? Is it the testicle itself? Really, really simplistic explanation, but that's roughly what they're doing when they're looking at these things.
No, it's a perfect explanation. It's because it is so complex, as you said. You could literally have you talk for an hour just on one topic in terms of obstructive reasons. It is so deep and complex. Fantastic. What does strike me is talking about this is it's almost like a path, isn't it? They call it a pathway. That's what they call it, isn't it? The treatment pathway. But you have your analysis, and depending on what junction you get to next, depends on what path you take the next one to get where you need to go. So we've talked about analysis. What factors can influence the results of?
Yeah, again, that's another. It's almost like another massive subject itself.
Yeah.
So the other thing I'm going to say, I am slightly going to go back. Oh, you'll kill me for timing purposes. But if anybody gets those results, because we've talked a lot about the normal, no sperm being seen, bits in between, 100%. If people struggle along this journey, please do contact the clinic to get some support from the staff that are there, because we're talking very, very matter of fact here, and I know I am. But if you do struggle along it, do talk to them to get that extra support for you as you go through the journey. When it comes to the laboratory analysis, we should be sending people leaflets that basically say, this is what we're doing it for, this is what we expect of you. Now, there's loads of things that can affect the outcome of a semen analysis. So, have you abstained from ejaculating, whether that's masturbation or whether that's sexual activity? Have you took the sample into that lab within the 60 minutes that you need to, so that they can actually look at that sample within their timeframes and do the test that they need to? If you're taking it from home, have you kept that sample warm against your body? I don't mean on a radiator or anything, just body temperature on its journey there. But also, there's a whole heap of other things. There's lifestyle factors that can influence sperm quality, such as alcohol consumption, recreational drug use. The big one is obviously anabolic steroid use or testosterone use, or other things such as that people use as performance enhancing treatments. There's also medications that people can take that are prescribed for them, and certain illnesses that can affect somebody's sperm quality or sperm production. Also, going even further than that, if somebody's had cancer treatment when they were younger or even before their journey, that can have an impact on them. And then there's other things such as sexual dysfunctions. quite clearly, and I know this isn't going into that detail, but if somebody's struggling with their sexual functioning or their relationship or they're overly stressed, that can lead to a whole heap of other issues as well. And we do find even something called retrograde ejaculation, where the semen goes into the bladder instead of coming out through the penis. We've even found people who are really, really anxious going through this process can sometimes have a little bit of retrograde ejaculation as well. We do see it more in diabetics, by the way, but equally, there's many, many, many things that can affect sperm quality and production.
Yeah, I guess this is where it's really important for the man to be really honest with the clinic, especially if they've given him, say, a health questionnaire or something along those lines, asking for the medication they're on, how they're feeling, all those kind of things, so they can really get that full picture. Because at the end of the day, you're there for treatment. It seems a waste of time if you're not honest about it, even though it is hard. That as a man to say, actually, I'm doing this, I'm doing that. I do drink too much. I am stressed. I do have this problem, erectile dysfunction problem. It's a lot for a guy to come up with, but it's vitally important for this journey, because it's the only way you're going to get the best result you can out of it.
Yeah, absolutely. I also think, though, I completely agree with you, but also we as professionals need to give people that space and area and be able to provide the situation so that people can have those open and honest conversations. We're not there to judge anyone. You are right. We need that information so we can make sure that you are supported through your journey, which is a difficult one in the first place. And we want to make sure that you're getting the right support and management options based on the information you give us. There's things that can be looked at before you have to go through that entire pathway, which can be very, very difficult for many people. So I think it really is key that if you can, please tell us. If you don't feel that you're comfortable, please let the consultant that's looking after you know what is going on, even if that is 2 samples in. Just let them know. Nobody's going to judge anyone. It is there so we can make sure that we interpret your results correctly and that you and your partner can have the right management.
Yeah, definitely. I mean, between me and Sean, we talked to hundreds, thousands of professionals, and I've never met one that didn't want the best result for the patient, and we're truly there to help. So definitely speak out and just tell the truth, even if it is tricky. So we've briefly brushed over, because we could do with so much of this webinar, we could talk for hours on one topic. But what are the things that people can do to try and improve their analysis, their results, in a nutshell? Because obviously it's a big topic.
Yeah. Yeah, it is. Right, so I'm going to put in something right from the very get-go. Is you can't always see the changes that you would hope to. So from the very outset, if you've got that report of numbers, it's really important to know that that can fluctuate between person. You could ejaculate the exact same days for each week, and we still would get fluctuating results. So we won't always see the improvements as you'd like to. Things can improve on a different level that we just can't see in the lab. There are other tests and things out there, but fundamentally, we can't say that these sperm are much better. It's really difficult to do that. But if people want to give themselves the best chance and try to improve sperm quality, they can do really generic things like health and well-being, looking after yourself, having a good, balanced and varied diet. There is talk of supplements, and actually a good varied diet will do you just as good. To stop smoking, to make sure that you reduce your alcohol intake down, at least to make it less than the government's recommendations. I think it's 14 units. Please don't tell me off if I get that wrong. And also, as I say, just to make sure that you're having that balanced diet, keeping your stress levels under control. I am not going through what a lot of people are going through who are probably listening to this. but do your best to try to give you and your couple time to try and relax through this process as best you can. Stress does not help the situation. We know that it influences things. So it's really important that you give yourself some time through this process and sort of a bit of self-love through it all. But yeah, I think that's probably it. If we're going to do a very brief in a nutshell, there are other things like if you're doing work and that involves overheating your genital region. Again, I'm not going to go and say go and get a new job, but you do need to be aware that there's many different things that can affect sperm.
Yeah, definitely. It's I mean, they're good pointers, aren't they? You know, just look at what you're eating, think about what
Mm.
you're putting in your mouth in terms of it's cheesy, but the saying "you are what you eat" really is true.
Yeah,
And also the alcohol and the smoking, de-stressing. There'd be people listening to this to say, "How am I supposed to de-stress when I'm going through one of the most stressful situations I'll ever be involved in?" Um, but giving yourself time to kind of acknowledge that you're stressed is almost a de-stressor in itself. Like, yeah, I need to step back from this, or I need to go and do something. And it's another thing, isn't it? Like, give yourself time. Don't change everything at once because you'll end up more stressed than you did right at the beginning.
yeah.
So those gradual changes are vital. So if you make those changes, what what is the realistic expectations people should have? Is it a sudden change or is it a gradual change in their analysis?
Yeah, I slightly hinted at this before. I wouldn't say to anybody to base change on purely what their results are coming out as. Sometimes we can't see those changes down the microscope. So there might be subtle changes. There is some evidence that actually there is improvements, but there's a lot of issues with the evidence out there, and you can't always measure improvements. The way I always look at this is if you are looking after yourself, you're giving your sperm the best chance that they've got. Now, that might not mean that you're seeing them suddenly all move a lot quicker. You don't suddenly get loads of numbers, but I would say that the change could be happening without it being recognized in the lab. Now, the other important point, though, is I mentioned that 3-month-ish cycle for spermatogenesis, which is the production of sperm. So again, if people are wanting to see how their sperm quality is, you have to give it those 3 months roughly, depending on what's going on in your life. If you've stopped anabolic steroids, you're going to need potentially more time than those 3 months for your body to kick back in. If you've stopped smoking as much cannabis, you may need to spend longer than that to see the effects. But fundamentally, it can be really difficult to put a time frame to things. And even then, it's not necessarily that we're going to see the changes down the microscope, except for certain cases, as I mentioned, with the steroid use, for example.
Yeah, thank you, Stuart, just clearing that up because I think that's one of the big questions people ask, isn't it? How long? How long is it until I see change? And the truth is that it's all individual. There isn't one size fits all. All the information you've given us tonight has been amazing. We've had a few questions come in. So, does age impact semen analysis results?
So there is evidence that actually paternal age will absolutely affect the sperm quality in terms of its DNA. There is evidence of gradual decline, but many men will still produce many sperm that will be moving perfectly well as they get a little bit older in years. But there is evidence to say that obviously it almost gets as important as the female age after a certain point with men. So again, the younger the chap, probably is going to be better. But it's not the same as it is in women where they've got that biological clock that then obviously puts a pressure on. And obviously the quality of eggs as a lady gets older is quite significant. But there is definitely evidence out there to say that paternal age can impact sperm quality.
Yeah, I guess we all occasionally see those. rock stars in the newspaper that have had kids at like 83 years old, and it kind of
Yeah,
gives you this fake perception of, you know, the male reproductive system. Like it still struggles when you get to that age. But it was a great question, and I think a
yeah.
very valid answer there. What happens if you can't produce a sample? That's the next question.
Yeah, it depends on the context, really. I know most people, if they actually have sperm and they're going to be going through a fresh cycle of treatment, obviously that anxiety can just be absolutely awful for anyone doing it. My first piece of advice to anyone is talk to the people who are supporting you at that moment that you're in that laboratory service. If you're on site, talk to the andrologist or embryologist who took you into the room. Ask to speak with somebody who you can have a talk with about your difficulties. We mentioned how difficult that can be, but what we don't want is people to go away and never come back. We would much rather people tell us that they're struggling. We do understand, we see it quite a lot. And we even have staff who are trained to support people going through that. So the first point I'd say is absolutely talk to the person who put you in the room or who you booked your appointment with, see what they can do. Some places will be a lot more flexible with appointment times. So the lab has a lot of control over its appointments. Not all of them, I can't speak for them all. But sometimes we'll give people, instead of an actual direct appointment slot, we might be able to say to drop it off within a 4-hour window just to give a bit more flexibility. If you was asked to do it on site, we can say, would you prefer to do that at home and then bring the sample in? So I would just encourage people to 100% have that conversation. In the past, I've given patients who have come to our service a week long and just said, any morning of this week, see how you feel when you get up. As long as you give me a call before you're on your way, then I can make sure there's somebody available to do your test. So we all have our different approaches to it, and it really does depend on what the main issue, because we completely get doing a sample, having the timing issue, having an appointment slot, being in a hospital. None of these are going to help anybody. So please do open up that conversation with us.
Yeah, it sounds simple, doesn't it? In terms of just walking in and giving your sample. The men get the easy bit, but actually it's not easy at all. Like it is really difficult, and when it doesn't go quite to plan, there are once again people there that can talk you through it in terms of how you're feeling and kind of get a good result at some point, isn't it? That support is there.
This, the other side of this is if you've got any other issues that might be contributing to that, if you've got any sexual dysfunctions or ejaculatory dysfunctions, talk to your doctor about whether there's anything they can do to support you. And as I said, there are people who've been upskilled. If they don't know, they can tell you where to go to get that support. So I know it can be incredibly difficult. A lot of people do struggle with producing their sample, and I absolutely 100% understand why. But again, as I say, it's just about getting people the right information to support them through it.
Yeah, and I guess if you have got a pre-existing condition and you disclose it, can plans be put in place to specifically manage that? That's what we've really been talking about, isn't it? So once again, it comes back to being honest. Really be honest about it, even though it is so hard. Next question: can I use lube during giving my sample?
Yeah, it's a good question because I think everyone, a lot of scientists will be like, oh gosh, no, whatever you do, no, don't do it. But, there's people who need lubrication to masturbate. That's just a fact in life. So the truth is, many lubricants will actually kill sperm. Even ones that say that they are non-spermicidal, more often than not, will kill sperm. There are a few lubricants on the market, but what I would say is it's safer not to where possible. If you do, tell the lab, be open and honest, because if there is a reduction in the sperm moving, that could be the reason. But it can also affect how we process the sample in the lab. It may make things more difficult. It may change certain results because we don't know what that substance is doing to your sample, and therefore it can change your management dramatically. So I'd say no. If you do need it, though, talk to the lab. There are some things that some services use. In our one, we use an oil that we use in embryology that covers over eggs. So that doesn't kill things, of course. And we tend to find that works quite well. So it's not a lubricant, but it's something that we know doesn't kill it. We can test things in the lab to make sure, excuse me, to make sure that those items don't kill sperm. We do sometimes provide condoms for people if they want to have sex with their partner, and they've usually got something on. I think it's just petroleum jelly that actually we know won't harm sperm either. But we do always check that in the lab. So that's one of the reasons good quality control is important in the lab, because we will check things. So talk to the lab is what I'd say. See what they advise, and if you do need it to masturbate, tell them that, because it's no good going around this route of somebody saying no, you can't use it if you need it. I mean, that's just going to be another thing to stress about it, and you'll never be able to produce your sample. People use soap because they get quite desperate because there isn't any lubrication. These things will really affect your results. So no, but talk to your lab and see whether or not they can give you some advice.
Yeah, it's a really interesting question, because I always thought it was a straight no, you can't do it. It's like the forbidden land. You can't do that. But actually, as we've learned today, it's really about what works for you and trying to get you over the line in terms of producing that sample. So talk to your clinic. Right, we've got two more questions. We've kind of talked slightly about this one, and it's about supplements. Should I use supplements to boost my sperm quality? Do they work?
Yeah, now I've got to be careful how I word this. There is some evidence to support that there are things that we consume in our diets that do help sperm quality and sperm function. There's coenzyme Q10, for example, zinc. So we know certain things will help our sperm quality. What I would say is go back to that. A healthy, balanced diet will be the best thing for you. If somebody does advise on supplements, ask them the question about why, what benefit will that be? My thing is always about just know what you're consuming and tell the people who are managing you and going through this process if you are taking supplements. They're not all the same. And again, you've got to be careful with the word supplement. Know what you're consuming is what I'd say. There was a recent study not too long ago about men in the gym environment, or people in the gym environment, and actually the lack of awareness of what you're consuming is actually one of the concerns, because do you know what impact it's having? You can have too many vitamins and minerals in your diet, for example. So I would say have that open conversation with who's looking after you. There's nothing wrong with some supplements. The evidence is a little bit shaky, to say the least. But a good healthy diet would be the best thing from my perspective anyway, and I'm sure many other people's.
Yeah, you can't replace just a good healthy diet. Like, it's natural, and it's how we're supposed to consume things. And you touched on gym supplements. I think I could talk for an hour on that one. Like, they are, you've got to be careful with what you take in there. But maybe
Yeah,
that's another webinar, I feel.
yeah.
Right, last question: are home tests any good?
Yeah, I mean that's another hour-long webinar in itself. Okay, so I don't. The evidence is out there that actually there can be a very useful tool. So in my experience, there's a lot of people who do struggle to go to their doctors to take that first step to help to take control of their fertility journey. and some of them can be very good at giving you an idea. And there's some of them that are quite advanced now that will give you a really good idea about what's going on. There are limitations. Um, some of it from a personal perspective, I do think we get into the realm sometimes where it's almost like they support this ongoing obsession with checking your results, giving you supplements, checking your results again. Where you're going to go then? You know, if you can buy a kit of 10 things to check your semen analysis, we would never do that in the NHS unless there was a particular issue. So I'd say just be careful about what products you're getting. But if there is something that's being highlighted, it could be a good thing to take to your doctor to start that conversation going. There are limitations with many of them. Most tests will not have UCAS accreditation. I don't know, I haven't looked at them all out there, but again, importantly, having a test done and knowing that it's high quality is very different than a test that gives you a lot of fancy numbers that tells you how accurate it is. So do be careful about the kind of test that you do go and use, but there are some very good ones out there, and I think it's a great thing to get people who won't go to their GP or want to know what's going on as a good first step. But there are limitations. There's many pros and cons for each individual particular kit. But I think some of them have got an amazing potential.
Yeah, I agree. I think they're a really good starting point. They can kind of just give you that sign that something might not quite be right. I guess always make sure you get them interpreted correctly by a professional, or rather than Mr. Google doing it.
Yeah, not Mr. Google.
Yeah, not Mr. Google. He's getting cleverer, but he's not that good yet. Well, thanks so much, Stuart. I've really enjoyed our conversation, and I hope listeners have, and people that listen to this in the future will as well, because you've really kind of set it out simply, right from the beginning of the analysis, why you might need one, to what you can do to improve it, and how it goes through the whole lab process and things. So thanks so much for your time, and I will speak to you soon.
Excellent, been a pleasure. Thank you for having me.
And like I said, we'll definitely talk again soon, I'm sure. Take care.
Excellent. Cheers. Take care.
Bye.